think the CID, the school, it's an organization consisting of four consultancy, a school, a research department, an incubator, and I think CID was nominated as the 15th best design school in the world last year. So I will try to give you an introduction to the application Remories that I've been part of designing. My name is Anders, and I have a background in engineering and interaction design. And then I'm also founder of Remories, which is an application developed for young people with Asperger's syndrome with the main purpose of making them more confident and independent. The main principle behind Remories is to remember and capture your good stories. The application will remind you of these stories when you stand in front of challenging events or need support to work on personal goals. Remories also allows users to share those stories with other users with similar condition, diagnosis, or challenges in a way where people can learn from one another, motivate and be motivated by others. And let me give you an example that I guess most of you are able to relate to. A lot of us would like to get in better shape, but I don't know how you feel about it, but I often find excuses why not to go for a run. It can be the weather, it can be a hard day at work, it can be a lot of things. But if I do manage to go afterwards, I feel empowered, and it's hard for me to understand why it's so hard for me to go in the first place. So imagine if you could capture that emotion or that feeling, that empowerment, just after you've been on that run and save it as a photo, as video, or as notes, the way that you prefer, and then be exposed to that feeling, let's say 30 minutes before you go for a run the following week. We believe that this will actually help you to go out. Remories is a result of more than 100 hours of co-creation and research, and this approach allows you to get an understanding of how clinical definitions affects people in their everyday lives. In this process, we use something we like to call rapid prototyping, which helps you to test out ideas or features in a fast way. In this process, we believe that you can actually test up to 90% of a feature or an application by using very, very simple means. Paper prototyping, it can be video prototyping, scenario drawings, it can be many things. And there is so much great technology out there that you can quite easily hack and make use of in this testing, and I can definitely recommend to do that. Rapid prototyping also allows you to try out things fast, as I just mentioned, but it's also important to highlight that good design is not something you get right in the first place. It's all about iteration and testing. And excuse me. And it just takes time to get things right. Remories is a framework that collects a mix of quantitative and qualitative data. The application tracks mood, it tracks what events the user is participating in, and it also tracks what goals that he or she is working on. But it also collects memories. And the format of these memories is defined by the user. It can be, as I mentioned before, a video, it can be notes, or it can be photographs. But what's interesting about memories is that you're somehow able to relate the quantitative data to the more qualitative data to the memories and add extra value. We believe that this data could be useful for a lot of different people. As Carsten mentioned, in Denmark we have this welfare system. It could be teachers, parents, therapists, GPs, in general people in the user's care network. But if you want to share data, the framework also needs to be very transparent and trustworthy. And as Carsten mentioned about user involvement, we believe that this can only be achieved by including people, the end users, in this process, and by giving the ownership of the data to the users for them to decide who should be able to access it. In order to prototype how this framework could work in a setting between private and public organizations, we teamed up with the Rockwool Foundation, who is currently prototyping a new intervention, a new service in collaboration with Roskilde Municipality. Basically, it's about reconnecting disconnected youth through internships. And I could talk a while about this new great intervention, but what's interesting to mention in relation to Remories is that a lot of these young individuals are disconnected due to mental health issues, depression and anxiety, etc. So it was a really interesting for us to try out this application in a new setting, since the principles are actually quite universal, something that a lot of people can relate to. So we're currently trying to understand if we can reframe or what it would take to focus on people with anxiety rather than just people with Asperger's. It's no secret that we spend a lot of time focusing on how to develop a product that actually works for people, and a lot less on how to make Remories a sustainable business, because we are a startup with everything there is to it. So we just recruited some new team members who will primarily be focusing on the funding we need in sort of to enroll the activities that we are interested in. And one of the things we would really like to do, and we actually applied with Carsten last year, is to do a clinical test to get a better understanding about how this framework actually performs. So I think it would be a shame if I didn't use this possibility to also mention that if anyone in here could be interested in contributing or being part of this process or just following it, you're more than welcome to get a hang of me after this presentation or during, while we have lunch or something like that. Yeah, I think that's it.